I'm Amanda Whittal, Research Coordinator for the Foundation for Alternative and Integrative Medicine. FAIM's goal is to share information about health options with the public through the expertise of over 100 guest writer medical practitioners, as well as international projects to learn and share options for health that are available worldwide. All information can be found on our website at www.faim.org. And as part of this work, we regularly interview practitioners from clinics and health centers that we feel the world should know about. We hope you enjoy today's interview. Welcome, everyone. I'm here with Dr. Margo Roman, a renowned integrative veterinarian with over 30 years of experience. She runs the Main Street Animal Services of Hopkinton in New England, offering both alternative and conventional medicine, and has pioneered the use of fecal microbiota transplantation, or FMT, in animals. Besides her practice, she lectures at international conferences and universities on integrative medicine topics. Dr. Roman, thank you so much for being here and taking the time to speak with FAIM today.
Thank you very much. And again, it's so important for people that are doing this for themselves to understand that it can be done for your animals as well. And sometimes it's very easy for people to adapt to something when they see the improvements of their dog and their cat in their home. And that's why, having this portion of my lecture talking to the audience when it's really a human group, but to understand that our animals often mirror us. And as veterinarians, we're trained to understand human, medicine. And we study zoonosis, we study infectious diseases, we study all these things. And if there's a way of bringing that quality of options to the dog, and the owner knows that, wow, I saw that improvement in my own animal, how do I do that for myself? And when they do that for themselves, they can then find practitioners like you're dealing, trying to educate the families about these other options, that they can find people that do the same kind of thing. And that's a lot of my client base, is they come to me because they want another option. And sadly, in my profession, if the veterinarian only knows standard of care, which has a limited area of information, and their only option is $10,000 worth of surgery or euthanasia, there could be euthanasia because of a financial component or the unpredictability of the surgery and the radiation and the chemo and everything else. So if an owner finds out, or a pet parent understands, wait, I can do acupuncture for that. Why would I need back surgery? If the dog is paralyzed and I can do acupuncture and ozone, why wouldn't I try that before I have to spend, $8,000 on surgery and then months of rehab trying to see if it can even work, and it may not even work.
Yeah.
So that's the option. That's part of, why I'm so passionate about it, because, if it works well, why aren't we trying that first before we go and go down that whole rabbit hole of a lot of things that can end up with euthanasia? So that's part of it.
Well, I think it makes perfect sense to me, and it's so important. You kind of answered partially my initial question to you, was the fact that you are very passionate about the integrative approach for animals, and I don't, perhaps I just don't know, but I don't see integrative veterinary medicine that often. I think it's a great approach.
Yeah, no, you said it was over 30 years, but it's actually over 45 years
Oh.
of practice. So anyway, but I was very fortunate in veterinary school and I went from 1974 to 78. And in 75, I was the first woman to take the veterinary acupuncture course in the country. And when you're in that position where you're in a learning mode and you find something that wakes up your brain and you go, oh my gosh, what is this? Having a paralyzed dog that was going for surgery, the surgery didn't usually work, and the dog was walking in about 3 hours or standing.
Wow.
To me, was a miracle, right? And the horse that was going to surgery for colic back then, almost 50 years ago, 45 years ago, 48 years ago, he was going to go for surgery, and the acupuncturist came in and did the procedure, and the horse defecated and didn't need colic surgery. It was a miracle, because the other was so iffy and very unsuccessful those many years ago, that to have that happen and you see it in your own eyes, you go, oh my God, why can't I learn this? So it was just, it's like you open your eyes, you pull the veil back, you go, let's have options here, let's have opportunity. But if the veterinary school is paid by big pharma, and the dog food companies and the medical schools are, and the dental schools and the law schools and the boards are, you cannot get these options within the university. So the university, as much as it's the high end of what we do, they are very limited on what they can say and do.
Mhm.
And that has been a very vocal point of myself, is that, when that happens to you as a both a faculty member and a pet owner, then you have to stand up as a veterinarian. And so that's why I have I've stood up to, the university and said, wait a second, I don't want to euthanize. Can I do something else?
Yeah.
And they're like, no, euthanasia is the only thing you can do. And I'm like, no, I'm not. So the whole story of why I've become such a loud advocate is my own horse, who I rescued. This horse at 16, he was going to be euthanized because he had such bad allergies. And I rescued him from my daughter, and we resurrected him and did homeopathy and, acupuncture and all this stuff. And he was jumping in horse shows in about 6 months and
Wow.
doing all this stuff. And it was beautiful. He's a wonderful, wonderful horse named Champ. And my daughter was, and then at 20, he got cancer because he had been on so many antibiotics and drugs, suppressing everything when he was younger, because he had so much allergies and everything else. And so he got cancer. And I said, treating him for cancer with conventional was surgical removal. And I don't want to do that, because I had two other clients that had the same lesion in their horse's eyes that went to the university, and they surgically removed it. And within a year, it had metastasized into the brain. And I said, I'm going to do it differently. So I did it with homeopathy and other things, and an ozone. And at six years later, he needed his eye removed at that point. So he got 6 years with that. And I took him to the university, and they said, he's going to be dead in 2 days. You need to euthanize him. And I wouldn't. And
Mhm.
he lived 2.5 more years jumping in horse shows, getting ozone treatments. And that's how I got involved in ozone, is because I saw how it gave him the energy and the positive. And so now I've done probably 80, 90,000 cases, I mean, treatments of ozone over the last 20 years after learning it on my horse. And so for those of you, that there are veterinarians that are getting trained around the country that do ozone therapy, and you can try to Google that. There's several groups that are out there. There's O3 Vets, and there's Regen 3 1. You can go on my clinic website, which is mashvet.com, and find some of these links to other groups that do support. The American Holistic Veterinary Medical Association, where there are veterinarians that are international, are members as well, is a great resource to look for people in your area that have other opportunities. And they give a list of, different modalities that these people can do. So, when you're frustrated and insulted that the only thing you have is euthanasia, for me, it was like, I'm not doing that, especially to have him a total of 8.5 years more than the standard of care, to me is significant.
Yeah.
And to voice that and to speak it up has been a real thorn in the veterinary board in Massachusetts, and they don't like you to speak up. You just have to follow the rules and don't say anything. And I find it extremely sad that the standard of care needs to be much higher. Same thing in medicine, in human medicine. And so we need to have people speaking up and telling their cases and telling their stories. And they'll always say it's anecdotal, right? Because
Mm.
they don't have double-blinded studies. And so we need those double-blinded studies too. Those are important. Science is important. But when you use science in a way that you financially can't do it in other ways, because you need big, huge pharmaceutical companies to fund your research. And then, of course, if they've given you $2 million to fund your research, you better come out with something positive for them, or you're never going to have a research project again. Oh, but that's a problem. And
Yeah. Yeah.
there's so many wonderful modalities that are out there, and finding those for your animals is what, we want to try to do with integrative in veterinary medicine.
Absolutely. And indeed, it sounds like nothing short of miraculous to extend your horse's life by 8 years. I think, I guess you've already given a lot of information on it. One of my original questions was why do you think it's so important? But I'd like to change that a little bit and just ask you, because you do, my understanding of integrative medicine in general is using everything that is available that will be beneficial for the health of the one receiving it, whether it's a human, whether it's an animal. And I understand you do that in your clinic. So you do
So,
use.
as much as I know this much, right?
Mm,
So the more I know about these modalities and the more I study it, the more I know people that know more than way more than I do.
mhm.
And so I'm always, like I feel like I know very little about that. And so like I work with a chiropractor that is so much better than my chiropractic. So
Mm,
why not go to the best? So finding a network, and the same thing for in human medicine,
yeah,
finding the best person in your community that can do your chiropractic or your osteopathy
yeah,
or your homeopath.
yeah,
And it would be wonderful if we could have all these people in one place that you can not have to drive, 25 minutes, an hour to this one, and then, back here to this one, and then back there to another person. But it's really hard to become good at everything is really hard for any doctor. That's why in human medicine, they just specialize in eyes.
yeah,
They're
yeah,
one part of the body. They're not going to tell
yeah,
you how to take care of your teeth.
yeah.
They're going to tell you how to take care of your vaginal infection, they're
Yeah,
talking about
yeah,
eyes, right? So, but in veterinary medicine, we have to do it all, but there are specialists. The sad part is the specialists aren't getting any of the integrative information because
yeah,
they think the quality medicine is, get your MRI and your CAT scan and your laboratory. And the same thing has happened in human medicine. And all of you out there know when you go to a doctor, they're not touching you and feeling you and looking in your body. They're on the tight, they're like this. This is the vet, this is the physician and the veterinarian with all the digital medical records that we have to keep up. You can't, at least for me, I have to look and feel and sense something and think about it. And if I'm sitting there typing the whole time and
mm,
trying to type, I don't accomplish that.
yeah,
So,
yeah,
maybe some people can multitask, but to be good at 12 modalities and be the best in the world, I don't know if you're going to find anybody who is,
mm,
right?
yeah,
So you've got to find people that are the best of what they do. And that includes a good surgeon. I mean, you need
yeah,
a good surgeon. When you need a good surgeon, you
yeah,
find a good surgeon, but you can't, um, to have somebody who can do it all, there's very few people that can,
yeah,
but it's important to one of the big pieces is if that person knows nothing about acupuncture, chiropractic, or herbs or
yeah,
anything, and the only thing they know is standard of care, and they say there's nothing else you can do or euthanize your animal. I'm sorry, that to me is,
mm,
I want to call it malpractice. It is malpractice because there are so many other options.
yeah,
And it's not according to the boards,
yeah,
not according to the boards because it's standard of care. So if the standard of care in your state or country or whatever is saying, you have to follow the standard of care, and the standard of care does not include alternative medicine, then the standard of care is severely tarnished.
yeah,
And need to be able to talk about these other ways of doing it. And if they think they have all the solutions, then my goodness, boy, do they have a lot to learn, a
yeah,
lot to learn.
yeah. Yeah, and I suppose my takeaway from it is there's space for both. There's really a place for both, and it's using.
Absolutely. Emergency medicine, your dog gets hit by a car, you don't want a chiropractor just to be adjusting the dog. You need emergency medicine. You need good x-rays, you need, orthopedic surgeon, you need emergency, oxygenate, you need all that stuff.
Yeah,
But if the animal has chronic, GI problems and all they can think of is antibiotics and diarrheals and anti-nausea medication, and you don't do a fecal transplant and you don't do oxidative therapies like ozone,
yeah,
are, first of all, causing severe antibiotic resistance or
yeah,
antimicrobial resistance. And that's where we can flow into that with the fecal transplant. So with the amount of humans that are dying from antimicrobial resistance is now 1.3 million humans a year due to antimicrobial resistance. They expect it to be almost 30 million by 2050. Antibiotics are from the 20th century. We need other options to help with infection and inflammation and pain. And that's how I've learned with ozone therapy that it does that. Ultraviolet light therapy, all these other therapies where we're using light and oxygen to treat the body is so valuable. And I've had case after case after case that could not get solved, including coronavirus in a dog, that the dog was on 2 different antibiotics, was sick as can be, was lethargic. We did medical ozone, ultraviolet light therapy, and a fecal transplant. And the dog stopped coughing in the car on the way home and recovered after 2 solid weeks of just being sick. So to talk about coronavirus in animals, I feel I'm qualified to do that because I've treated coronavirus in cats and dogs. And medical ozone is amazing for coronavirus. So just because it's a dog doesn't mean that it can't be similar to a coronavirus in a bat, or right,
Yeah,
So,
yeah.
these modalities need to be encouraged, and not the doctors that are doing it are getting attacked and they're getting their licenses taken away. And including myself from mentioning ozone for a cat. For coronavirus, I got my license taken for 2 years. This is really not right. It's
Yeah.
wrong. And to help animals and humans get ahead of it and stay healthier should be the goal of everyone, right? So that we don't, people are healthier and can do more and help other people instead of being burdened with their health or the animal's health, and they're constantly just taking care of the dog and it can't have a normal life.
Yeah, yeah. It's a huge burden for both
Yeah.
sides, for the animal and
Right,
the owner.
right. So,
Um, Indeed, I think the integrative approach is kind of the golden star in terms of having everything available that can help us with animal health, with human health.
mhm.
You did mention ozone and FMT a couple of times, and
Yeah.
I wonder
So
if you can just
Yeah,
explain a
so
little
the
bit.
word FMT, which is fecal microbiota transplantation. I had read about fecal transplants in the early, like in 2000. I was reading about that. And I thought to myself, dogs eat poop anyway. So why don't we give them healthy poop instead of not healthy poop, right? And so, I was raising my own personal standard poodle that I got as a puppy who was, healthy but not healthy, and said, I'm going to raise this dog to be the healthiest dog and do all my modalities on this dog, that, no antibiotics, use homeopathy, at that time I was not even using ozone at that point, but doing Chinese herbs or Western herbs or, Ayurvedic herbs or whatever I was using. So now I'm on my 7th generation that have been raised that way. But in 2012, we did the first fecal transplant on a dog, and it was a miracle. It was unbelievable. The dog completely shifted. And so I was the first one to start doing it in small animals. In veterinary school, we did it on cows, we did it on pigs, we did it on horses, and it was never considered anything like if you had a pig that had diarrhea, you would give it poop from a healthy pig. I mean,
Mhm.
that was something, but nobody took it into the small animal realms until I started doing them in 2012. And I saw these animals just shifting. And when you think about what we have done to our pets in the last 50 years, it's been antibiotics after antibiotics, generation after generation, flea products, heartworm preventative. All of these damage the microbiome. And if we are supposed to have 4,000 species in balance in our gut and our whole, GI tract, how do we get that back if your great grandmother was on antibiotics for 2 months for Lyme disease or whatever it was that we were treating them years ago? How do you get that back? And I don't know if you can. So for 30 years, I have protected my generations of dogs by doing integrative medicine. And we decided the word FMT was not the right word to use because what we call it is microbiome restorative therapy. So we're not only just giving them fecal microbiota transplantation, we're using functional nutrition and functional medicine to build the terrain of the gut so that the gut can actually maintain itself once it gets the new microbes. So to accomplish that, we use medical ozone to reduce the biofilm. Now, medical ozone is amazing. And any of you out there that haven't done that for yourself, you can do it for yourself. You can get ozone generators and do it for your animals. And you can learn how to do it for yourself through the doctor that does ozone, or there's videos and stuff. But I don't treat people. I only treat animals. But I want to empower them to get things for their animals because, again, we go back to that first thing. They see the improvement of their animals and they go, oh my God, why don't I do this for myself? Whether it be eating fresh food and healthy food and understanding why it's so important not to eat processed foods and chemicals and preservatives and everything else. So it's just kind of a learning piece that they learn from their animals. But back to the microbiome restorative therapy. So we use our donors. We call them Touch of Life Microbiome because that was my kennel name. And we are now shipping to a company called Legacy Biome, which is based in Canada, and that does ship to Europe. So people can get that microbiome from our 7 generations. I make their own food. Everything's organic and fresh, and it takes about 25 hours every 3 weeks to make this really healthy food that is feeding their microbes. They would much rather eat something else.
Like humans.
Like my kids, right? Like I feed them like really healthy, organic this and that. And why can't we have Kraft macaroni and cheese? And I'm like, because it's plastic and you're
Always.
eating it, right? So, but dogs would rather eat stuff that, but my dogs are the first 17 years were meat-based raw. So they were raw fed. And then the last 12 years or 13, well, let's see, 12 years. 12 years has been predominant plant-based.
Okay.
And we can get into that. That's a whole nother story. But by doing the fiber in the plants, you're really feeding those microbes.
Yeah.
But I still use raw meat because they're bacteria that like putrefied meat,
Yeah.
and there are certain needs that these bacteria have. So, by feeding that, and I can get into the whole idea of sustainability and compassion by feeding a predominant plant-based diet, and those are very significant. But by getting these animals and not using pesticides, not using herbicides, my house I built it myself with my husband 42 years ago, and we built it green and sustainable. So everything in it is green and sustainable. We built it on 7 acres of virgin woods. So these dogs have been raised in an environment that is different from a lot of other animals. And I have never given them spot on pesticides and these once a month heartworm stuff not flea and tick stuff that kills their microbiome. And they do get heartworm, but they're on a limited amount. And I do a procedure that I've been doing for years that gives them reduced amount and then gives them back their microbiome back again. So we've been very conscious about this for a long time. And the miracles that we see are so beautiful that these animals that were so sick and had been everywhere and nobody could control their diarrhea, nobody control their allergies, and they'd been on antibiotics 10, 12, 15 times, give them a fecal transplant. In 2 days, they stop itching, went on all of these, Apoquil and Cytopoint and all of these drugs that are killing the microbiome. Instead, we just rebooting them and nurturing the reboot. And
Yeah.
that's microbiome restorative therapy.
I mean, it is very fascinating. And actually, the audience did hear an interview on fecal microbiota transplantation about a month ago.
Okay.
It is just to say, many of them will have at least heard of it, but I find it completely incredible. That was in humans, but I guess it's just that there are so many things that affect our health negatively that aren't so acute that we need antibiotics or surgery, but that we just need a healthy terrain to be in.
Exactly. And I think a lot of,
Ourselves.
some people can get it back. Animals, when I'm
Yeah,
talking, can
yeah,
get it back with doing probiotics and digestive enzymes and feeding themselves, healthy and raw vegetables and certain, Jerusalem artichokes and things like that that help
yeah,
develop the gut flora. And I always use this product by Zachary Bush called Gut Ion Biome, which is a fulvic and humic acid that helps the microbes communicate. And I use colostrum, which has immune globulins in it. And I have a whole protocol. If they're veterinarians that want to learn how to do this, they can go on our website and learn how to do this. And to me, doing just FMT or using the word FMT is like, I don't want to just throw poop at it and wait. I mean, I want to build the whole infrastructure so that it can heal and not just try to hope it sticks. Let's just throw it in there and hope it sticks. I think it works really well to hope and stick when it comes to Clostridium difficile.
Yeah.
And Clostridium difficile is the only thing that the FDA has approved fecal transplant in the United States.
Okay.
And it is like 97% curative with one treatment.
Wow.
So, how would it's amazing, right? And but you can't get the fecal transplant unless you have C. diff, which there are so many other medical issues that would so benefit from a new microbiome. So I'll tell you a story about Doris, who just passed away about a month ago. And Doris, she's my sister's boyfriend's mother. And 12 years ago, or 11 years ago, when my sister started going out with him, she told me about her, and she was an 85-year-old, 86-year-old woman who had severe dementia, was unable to walk because she couldn't take her Parkinson's medication because she was so nauseous because she had C. diff. So her GI tract was causing her so much pain, so much discomfort, and her mental capacity was gone, and she lived in a diaper because she had a constant UTIs, urinary tract infection. So when my sister mentioned that she had C. diff, I thought, oh, great, she can get a fecal transplant. And their response is, that's disgusting. We're not going to do that. That's really disgusting. I said, why? She's like, she's the only one who's qualified to do it. All these other issues she has.
Yeah.
So anyway, a year goes by and they decided she has to live in assisted living. She doesn't know where she is. She doesn't know who she is. She doesn't recognize many people anymore. She's really in tough shape. She needs to be kept in, assisted living. And so I said, just get her a fecal transplant. So in Medicare, fecal transplants, you have to have 3 separate hospitalizations for C. diff to get a fecal transplant, right? How much does that cost? Three times in the hospital, right? Yeah. She had done it twice and almost died the second time from the drugs. And she told her children she would never, ever do it again. So I said, have her pay out of pocket. So they looked at Cedars-Sinai in Los Angeles, and it was like $9,000. Mayo Clinic in Scottsdale was $6,000. And the Scripps Institute in San Diego was $750. So they drove there. It took 5 minutes. They got the microbiome from Open Biome, which is based in Medford, and took 5 minutes. They put a nasogastric tube and had it go into her. I spoke to this woman 5 days later because I'd never talked to anybody that had a fecal transplant. I thought, I want to find out because I can't ask my dogs, like, how do you feel, right?
True.
Right. So I called her and she said, I actually can think a thought through my brain and my gut doesn't hurt anymore. And so I'm able to take my Parkinson's medication and I'm able to stand on my own. I thought, that's great. 5 weeks later, my sister and her boyfriend cannot find her. She's at the mall with her friends, has her brain capacity back 100%, is walking on her own without a diaper, and she's back to herself. 5 weeks, right?
Wow.
5 months later, my sister goes to see her. She didn't know who she was because she met her as this demented woman in a walker in a wheelchair. She was this vibrant individual, and her son goes, this is how she was when she was 50, right? So she got all her brain capacity back. She got her urinary tract completely intact. She was able to take her Parkinson's medication and be able to walk and be doing that, and had her complete vital energy and vital force back from the microbiome. And I speak to her like once a year, and she just passed away at 95, right? or
Wow.
96, and she just passed away. And when I talked to her last time I talked to her, she said, I just don't want to keep living. It's too much work to be at this age. And but to think about how many people are in nursing homes that have lost their brain capacity, that have lost this and this and this. If we could do something as simple as a microbiome support and replenishing,
Yeah.
oh my God.
Incredible.
And, it's incredible that and she ended up going into assisted living and ran their activities department. I mean, she was like, she's not, wasn't somebody to be a slouch. She was an organized individual, and to lose her ability to think. And that's what she said was so terrible.
Yeah.
She couldn't think a thought through her brain.
Yeah.
So
Yeah.
the gut-brain connection is real. And when I presented these cases back 12, 15 years ago, when people thought I was literally full of shit, they just thought I was crazy.
Yeah.
And then all that gets applied in the human line. The information that I was giving these doctors at conferences where they were only interested in C. diff, they
Hmm.
basically told me they're not interested in anything else, only C. diff.
Yeah. Yeah.
And I got up in front of a whole group of physicians and researchers, and I said, I'm treating cancer with it. If I can get 80% of an immune system work, I'm treating cancer with it. I'm treating allergies with it. I'm treating behavior with it. And they're looking at me like, we are only working on C. diff. I'm like, and the 2 years later, 3 years later, I went to that same conference, whole track on how to treat cancer with the
Ah,
microbiome.
brilliant.
So these animals have taught me so much. And I feel it's my job to let the things that they taught me to be given to the human side and
Yeah.
let them learn. And it's been amazing, especially the gut-brain connection.
Yeah.
That has gotten so big, and you can now Google it, and it's not anything that you wouldn't find hundreds of
Yeah.
papers. So just as an information of science, in 2000, there was one research paper.
What
In
a
in
long way we've come.
2017, there were 17,000, right?
Wow.
2023 in April were 250,000 PubMed articles on microbiome.
Wow.
So this is such an important part of the immune system that if it's considered 80% of the immune system, and if you can get that to work, why wouldn't you get that to work? Why wouldn't you want it to be the first thing that you do,
Yeah.
not all these drugs and medications and the side effects of them and all that? But because the FDA does not want to release that because they think, oh, it could cause this and it could cause that. Well, look at what these drugs are causing. Why don't you let the body get the good things into it and make it work? Let's find the best donors in the country. Let's find the best donors in the world
Yeah.
and share that, right?
Yeah. Yeah.
And so at this point, my dogs are considered the best donors in the world. So, we're trying to share what we have and help pet owners find another way um, to help their animals heal. And that's really all I'm doing, is trying to encourage the body to balance itself out again and find a way to heal itself.
Huge thank you to Dr. Roman for sharing her valuable insights today. Visit the links below if you would like to know more about Dr. Roman herself, the Main Street Animal Services of Hopkinton Clinic that she runs, or MASH. MASH services, they've got a variety of integrated services for pets. And specifically, they do quite a lot of specialty in fecal microbiota transplant and ozone therapy, for which there's a new podcast available that you can find at Apple Podcasts.